mynews.studio.
A century-old killer is gone. Kenya has eradicated sleeping sickness. How did they manage it, and what comes next?
Today is August 24th, 2025. So, sleeping sickness in Kenya is officially history. That's a big shift. But can we unpack what actually went into this? For decades, the tsetse fly and the parasite it carries were a deadly threat, right?
Exactly. Human African trypanosomiasis, also called sleeping sickness, was almost always fatal without treatment. Rural communities, especially people working in farming and with livestock, lived with that constant risk. The disease could cause severe neurological problems if untreated, and for a long time, early detection just wasn't easy.
The World Health Organization just declared Kenya free of sleeping sickness as a public health problem. That makes Kenya the 10th country. What really changed to make this possible?
Several things, actually. First, treatments became much safer. In the past, the only options were arsenic-based drugs, which were toxic. Now, oral therapies are available. They're safer and easier to use, so more people could get treated.
And diagnostics improved too, right? I remember reading about rapid tests and better lab tools. Was that the turning point?
Yes, that was critical. Rapid diagnostic tests and better lab techniques meant health workers could identify cases sooner. That's crucial because untreated, the disease can be fatal within weeks. Early detection meant faster treatment, fewer deaths, and less spread.
But even with better tests and treatments, wouldn't the disease have stuck around if they hadn't tackled the tsetse fly? How did they approach vector control?
They focused on surveillance and targeted interventions. By closely monitoring tsetse fly populations, they could direct control measures to the areas most at risk. So it wasn't just about one approach. Diagnostics, treatment, and vector control all worked together.
How did local communities respond? Was community engagement a big piece of the puzzle?
It was actually central. Health workers spent time educating people about symptoms, prevention, and why it's important to seek care early. That built trust, and people were more willing to take part in screenings and interventions.
This wasn't just Kenya working alone, right? International partners played a role too?
Absolutely. Organizations like WHO, the Drugs for Neglected Diseases Initiative, and FIND brought technical support, funding, and access to new tools. Cross-border cooperation and sharing resources made it possible to keep the effort going over many years.
When was the last local case in Kenya?
The last locally acquired case was reported in 2009. After that, the final 2 exported cases were picked up in 2012. Since then, ongoing surveillance hasn't found any new local cases.
So what's next? How does Kenya keep sleeping sickness from returning?
They're maintaining strong surveillance. That includes continued screening in at-risk areas, keeping diagnostic tools ready, and monitoring both animal and tsetse fly populations. There are rapid response plans and a medicine stockpile, supported by WHO and pharmaceutical groups.
So the main focus now is staying alert. Is there still a real risk of the disease coming back?
There is always some risk. As long as tsetse flies and animal reservoirs exist, continued community engagement and funding for neglected tropical disease programs are essential to prevent a comeback. Advocacy also remains important.
Why is this important beyond Kenya? Does this have wider significance?
It shows that even old, neglected diseases can be eliminated with coordinated effort. Now, 10 African countries have achieved this, moving closer to the goal of eradicating neglected tropical diseases by 2030. The same strategies, community engagement, better diagnostics, safer treatments, and strong surveillance are examples that others can use.
Can these approaches really work for other diseases too?
Yes, the framework holds up. Vector control, early detection, community involvement, international partnerships. These can be adapted to other diseases, even if the details differ.
What are the main challenges Kenya faces to stay disease-free?
The biggest challenges are keeping up surveillance, securing funding, maintaining public awareness, and reacting quickly if new cases appear. The real danger is becoming complacent.
So Kenya's achievement is both an endpoint and a starting point for bigger global health goals.
Exactly. It's a model for disease elimination, ready to be adapted and scaled elsewhere.
Kenya's elimination of sleeping sickness is both a national milestone and a global message. Persistent diseases can be overcome. Thanks for explaining what it took, what worked, and what's ahead.
And thanks to everyone listening for joining us as we explored this major public health achievement.
Thank you for listening. This episode was powered by mynews.studio. Try it now for free.